What is mental retardation? Mental retardation or intellectual disability currently is defined by the American Association on Mental Retardation or AAMR as significantly sub-average general intellectual functioning accompanied by significant limitations in adaptive functioning in at least two of the following skills areas: communication, self-care, social skills, self-direction, academic skills, work, leisure, health, and/or safety.
The signs and symptoms that may indicate that a child is struggling with intellectual disability can be vast. Some may become apparent during infancy, while others may not be noticeable until a child enters school. The severity of the condition, which can range from mild to profound, will play a large role in the time frame during which symptoms will present. Possible signs and symptoms that may be indicative of the presence of intellectual disability or mental retardation. Late to roll, set up, or walk as compared to what is considered developmentally appropriate. Delayed of speech or having trouble of talking. Difficulty in mastering tasks such as potty training, dressing oneself, and feeding oneself. Shows difficulty or delays in learning. Struggles with problem solving and logical thinking. Has memory difficulties. Is unable to connect actions with their consequences. Does not appear to understand or pick up on social cues. Presence of health problems such as motor handicaps, hearing, vision concerns, and seizures.
What causes intellectual disability? Doctors can't always identify a specific cause of ID, but causes of ID can include trauma before birth, such as infection or exposure to alcohol, drugs, or other toxins. Trauma during birth, such as oxygen deprivation or premature delivery. Inherited disorders, such as phenylketonuria or Tay-Sachs disease. Chromosome abnormalities, such as Down syndrome and Fragile X syndrome. Lead or mercury poisoning, severe malnutrition or other dietary issues, severe cases of early childhood illness such as whooping cough, measles, or meningitis, and brain injury, near drowning, and infections in the brain.
Intellectual disability is a lifelong condition. Although there is currently no cure, most people can learn to improve their functioning over time. Receiving early ongoing interventions can improve functioning, thereby allowing someone to thrive.
Various therapeutic services can improve a person's adaptive behavioral skills. These therapies are helpful for many people with intellectual disabilities. Number 1. Occupational therapy. Occupational therapy assists people to achieve their goals, function at the highest possible level, maintain or rebuild their independence, and participate in the everyday activities of life. Number 2. Speech therapy. Speech therapy helps improve the following: communication skills, receptive and expressive language skills, speech articulation, and vocabulary. Number 3. Physical therapy. Many people with intellectual disability use physical therapy services to support their community participation. Since this enhances quality of life by maximizing mobility and self-locomotion. It also provides adaptive solution to mobility problems and increases sensory integration.
Effective skills training and educational approaches for people with intellectual disabilities have already been discussed. These approaches are concrete, systematic, and straightforward. These evidence-based practices are supported by a large body of scientific research. As we have emphasized, there is no treatment for intellectual disability. At best, some medical treatments are effective at reducing the symptoms of the condition causing the disability.
So here are some of the ways to accommodate students with mental retardation. Be as concrete as possible. An effective teaching method is to demonstrate what you mean in addition to giving verbal directions. Go step by step. Break longer, new tasks into small steps. Demonstrate the steps. Have the student do the steps one at a time. Give immediate feedback. Immediately providing feedback helps the students make a connection between their answers, behaviors, or questions and the information you're presenting as the teacher. Help the student learn life skills. Schools play an important part in helping students with these life skills, which include health and safety, personal hygiene, manners, getting along with others, basic math and reading, money management, and skills for the workplace. Address the social aspects of the school. Students with intellectual disabilities often have trouble with social skills, which can make it difficult for them to interact appropriately with their peers and become involved in the social activities going on at school. Teachers can play a positive role in supporting the inclusion of students with intellectual disabilities in classrooms and throughout the school. Communicate with your students' parents. Regularly exchange information with parents or guardians and work with them to meet the students' needs.